Hello, dear students and esteemed learners. Welcome again. Now, we are entering into the fifth week of our course on sociology of health. Right? So, in this week, we have identified the broader theme, which is public health. So, we will try to understand the various aspects and various dimensions related to public health. The term public health did appear in our discussion before also, and at one point of time, I stated very categorically that public health is basically the meeting point of the medical sciences and the social sciences. So it is interdisciplinary and it believes in a kind of convergence, right? So this much understanding we are having about public health. But now public health is a big phenomenon. It is having huge uh, significance in human history. We'll talk about how this public health as a phenomenon emerged, of course, in Europe, in the US, and then almost in every country world over. So, we'll have five lectures and we'll try to understand public health in different possible ways and different possible contexts also. Let us go to the first slide, but before that, let me talk about the topic of today's lecture. And the topic for today's lecture is emergence of public health in the United Kingdom and the United States. And this is lecture number 21. And in this lecture, I have covered few very important points. Need of public health. Why did humanity basically need public health? And historically, what were those situations and circumstances in which there was need of public health? And then the emergence of public health in the United Kingdom. What were those institutions which emerged? What were those practices which emerged? And what were those circumstances under which basically public health emerged in the UK and then also in the US? So, all these things we will try to cover. Now, here is huge uh, data. Huge in the sense that I have included 20 epidemics or pandemics that humanity has experienced in last 2500 years. Now we all are familiar with the epidemics and pandemics. Recently, very recently, we have witnessed COVID 19 and we are aware of the kind of severity that it causes, the kind of problems basically it causes, the kind of death it causes. So we are familiar with. But are we aware of the kind of epidemics and pandemics humanity has ever experienced? We may not have the details of those epidemics which took place maybe more than 3000 years back. But as of now, there are certain evidences available as identified by certain research papers about the occurrence of prevalence of certain important epidemics and pandemics. I have mentioned some of these here. You may see the plague of Athens basically occurred in the years 430 426 before Christ, and the location was basically Greece, Egypt, Libya, Ethiopia. although the diseases are generally stated to be unknown, but yes, some people have also identified those or tried to identify those as typhus or some kind of viral fever, and the estimated death toll was 75,000 to 100,000. Then 412 epidemic basically spread in the location of Greece, the Roman Republic, and it was caused because of influenza, and 10% of the Roman population basically became victim of that. That was the estimated death toll. Now let me say here that I've taken these information from some of the open access websites, publicly available information, and these are basically tentative because it's very difficult to know the exact number of estimated death. Even in the case of COVID 19, we are not sure about the total number of deaths. So, how can we know anything about the deaths which took place thousands of years back? But the historians and the other researchers have estimated those, and those are available. So, I'm talking about those so that we get an understanding about how basically the problem of pandemic and epidemic have created the challenges and the question of survival on humanity, and then how humanity actually fought back, because public health is an effort of the human beings to fight back, to have some kind of containment of those pandemics and epidemics, have some kind of control over the human agency. We can keep on these, but that will kill the time. So we will quickly view some of these. For example, you can see the serial number 5, Japanese smallpox epidemic. Now 735 and 737, the disease identified as smallpox. But what is the estimated death toll? 2 million, and that is approximately one third of the Japanese population. So, one third of the Japanese population. It's a huge number. Then the next one, Black Death, and that is also considered as the start of the second plague pandemic. Eurasia and North Africa was covered, and the disease was actually plague. And then the estimated death toll 75 to 200 million. That is 30 to 60% of European and 33% of the Middle East population. That is the estimated death toll. That's a huge, much more than our imagination. Then we also have basically the Mexico smallpox epidemic, and that was very recently in the sense that 16th century Mexico smallpox, and 40% of the population became victim of that. That means the problem was not remaining confined to one or the other part of the world. The problems were spread almost all over the world. Every possible region of the world about which we have some kind of understanding or historical information was experiencing some kind of impact of consequence of epidemics. And then gradually those epidemics were becoming pandemic also, because simultaneously there was a movement of people, right? So the moment movement of people from one country to another country or one continent to another continent started, mercantilism started. So the epidemics started to become pandemic. And then you can see that what was happening in this 16th and 17th century. And then at point number 10, you can see that in the 17th century, London got inflicted by bubonic plague. Then point number 11, Asia and Europe, then they witnessed the spread of epidemic caused by cholera. Then North American typhus epidemic basically inflicted Canada. That means it reached to the US also, because Canada is very adjoining to the US. So in one situation, Mexico had seen this. Another situation, Canada has seen this. Most of the European countries have seen it. Most of the Asian countries have seen it. That means epidemics and pandemics basically created huge survival challenges for the human. And not only thousands years back, but till very recently. That means they are keeping on challenging humanity. As we can see in this slide, in 1918 and 20, basically, influenza pandemic, which is known as the Spanish flu, and the mortality is basically 17 to 100 million. And then very recently, HIV/AIDS 1981, 42 million, again estimated, and COVID-19 2019 onwards, is still going on in some part of the world. So basically, what kind of understanding we are developing? We are developing an understanding that the world has experienced the severe attack of epidemics and pandemics, which were causing huge mortalities. And people, humans, have been trying to make some kind of survival strategy, some efforts, so that they can contain those epidemics, so that they can protect themselves. And this endeavor basically helped in emergence of public health. Public health measures have developed in almost all human societies in some or the other form. Now, quarantine of leprosy victims in the Middle Age and efforts to improve sanitation following the 14th century plague epidemics are few examples. So, we have seen that in almost all parts of the world, some or the other problem in some or the other form was existing. And that is why we see that there are so many different systems of medicine, because every culture was supposed to respond to the challenges they were facing. And that is why there are so many systems of medicine which emerge in different parts of world that we primarily talked about. But now we will talk about a situation in which biomedicine has not emerged, right? So biomedicine basically created so many conveniences in the form of identifying the cause of the disease and then having some kind of antibiotics or several other vaccines also. But before the emergence of biomedicine, the challenges were there. And how to contain, how to address those challenges, that was basically the world was trying to find out, and public health emerged as a result of that kind of situation. So, if we try to track the emergence of public health in the UK, then where from we can start? So, as per the literature available, we can make a start from the Public Health Act of 1848, because this was the very first law on public health which got passed in the United Kingdom. And 1848 is very important. 1840s is very important, because you may remember we talked about one of the important books authored by Angels, the condition of the working class in England in 1840s. Because 1840s basically was witnessing the impact of massive industrialization in the United Kingdom. The mid of the 19th century, because industrialization has started, and along with industrialization there were so many things happening. There was movement of people to the urban spaces, then there were congested kind of lifestyle because of the limited spaces, then shortage of drinking water, shortage of quality food items, then shortage of basically the civic amenities. So, Europe in general and England in particular in 1840s was witnessing some of the worst kind of consequences of industrialization. And we have already seen that the epidemics were adversely affecting England in the mid of 19th century. So those circumstances and the occurrence of the epidemic, those created the situation where this Public Health Act of 1848 became a reality. It established a special public health ministry for England and Wales. It established a central board of health whose job was to improve sanitation and living standards in towns and populous areas in England and Wales. Now, two or three important things we need to talk about here. First, that this Public Health Act of 1848 basically came into existence. Then it talked about a central board of health. Now, the job of this board was to improve sanitation and living standard. Now, sanitation got identified as one of the situation which can make the difference in the prevalence of disease and control of pandemic. So sanitation emerged as one of the important components of public health. And along with that, living standard. Now, living standard will include so many things basically. The housing is also part of that. Then some of the other civic amenities, basically the availability of drinking water, then the quality of the roads, all those factors could become very important, but we will try to understand how the things were seen at that point of time. One of the individuals who played an important role in its creation was Edwin Chadwick, a social reformer. In 1842, he published The Sanitary Condition of the Laboring Population of Great Britain. So, this is another important work. Basically, we talked about Angel's work also. Now, Chadwick considered that the most important steps to improve the health of the public were Chadwick identified some of the important factors. Now, what are those factors? Improved drainage and provision of sewers. Now, that is a very important study, that it is talking about the drainage system and the sewers. Then, removal of all refuse from houses, streets, and roads. Then, the provision of clean drinking water and the appointment of a medical officer for each town. So, Chadwick talked about some of these important interventions which could have made the health of the public better. So, that was basically creation of a platform for public health. The Public Health Act of 1848 was not perfect, but it was an important step forward. Now we come to another act, that is the Public Health Act of 1875. The Public Health Act of 1875 is another act of the Parliament of the United Kingdom and a significant step in the advancement of public health in England. Its purpose was to codify previous measures. Previous measures means we talked about the measures which were taken during that 1848 Act and some of the other things which were basically talked about by Chadwick, right? So there was a need to codify whatever previous measures were available, aimed at combating filthy urban living conditions which caused various health threats, including the spread of many diseases such as cholera and typhus. So we have seen that how cholera and typhus were actually creating the epidemics. Those were creating huge kind of negativity, huge number of mortalities. So now we can see the link between the spread of those diseases and the efforts which were taken in England to contain those things. The Public Health Act 1875 made it compulsory for local powers. Now we can see that there are certain things which are made compulsory, right? That means the law has started to take its own course. Now, what were those compulsory provisions? The purchase, repair, or create sewers. So sewers became very important. Then water supply became very important. Then lodging houses, the housing conditions became very important. And then the new streets and buildings also became very important. So again, we are finding that we can see that the new components are basically getting added within the framework of public health. So public health is growing, it is developing, it is finding new components which could help in addressing the problems of the day. The act acquired all new residential construction to include running water, water supply, and then internal drainage system. Now we have the drainage system also, and also led to the government prohibiting the construction of shoddy housing by building contractors. Then the act also means that every public health authority had to have a medical officer and sanitary inspector. So now earlier we were talking about some of the issues which were basically related to the material aspects related to life. Now here we are talking about the professional people, right? Some kind of professionals who can take care of the related situations and circumstances. And so basically the services of the medical officer and then sanitary inspector. Along with that, something important also happened. The local authorities renamed as a rural and urban sanitary authorities. That means some kind of differentiation basically started between the rural spaces and the urban spaces, because most of the urban spaces were having the plethora of the problem because of the migration which was taking place, and that was basically caused because of the kind of rapid industrialization which was taking place in the mid of 19th century in England, and basically in some of the industrial cities of England. So this is how the institution of public health or the phenomenon of public health was unfolding itself. The new regulations were coming into existence. Then new kind of interventions were emerging, and then new practices were also emerging, right? So those practices are very important. And at the same time, we need to keep in mind that at this point of time, biomedicine has not made the most important inventions or discoveries, right? The germ theory of disease was not known, and antibiotics were not available. That means the entire focus was on saving lives through these provisions. And that is why public health is considered very important, because it engages the domain of the health from all those social and cultural determinants perspective. And that is why we have been talking about the social and cultural determinants. So let us move to the next part of the lecture, which is emergence of public health in the US. So till now we have tried to understand that how the world was witnessing the problems related to epidemic and pandemic, and what kind of threat basically was there. Then we try to understand that how the United Kingdom tried to make an improvement through some kind of legislation, regulation, and then adoption of new ways of looking at the problems. Then talking about the civic amenities, the sanitation, then the sewer system, then the drainage system, then the supply of drinking water, and taking care of the hygiene and cleanliness of the environment, so that they can protect themselves from the occurrence of certain types of disease, primarily the communicable disease. So this was basically the process of emergence of public health that we have seen in the context of the United Kingdom. Now in this part, we'll try to see the emergence of public health in the United States, but we will focus only on the institutional part basically, because the process of coming into existence of public health is like that only in all parts of the world, because all parts of the world were experiencing the impact of epidemic and later on pandemic in some or the other way. So we will focus only on the regulation part, and it will help us to understand where public health is located or where public health was located in the US legislation. So let us start with the prevailing situation in the US. I have included these things very briefly, but you can try to understand these things at length. The United States Department of Health and Human Services is a cabinet level executive branch department of the US federal government. Right? So I'm talking about the contemporary situation. Right? Department of Health and Human Services. The United States Public Health Services, that is USPHS, is a division of the Department of Health and Human Services concerned with the public health. So basically this USPHS, that is the Public Health Service, is a very important institution, and this is a division of the Department of Health and Human Services. The Public Health Service Commission Corps, that is PHSCC, is the federal uniformed service of the USPHS and is one of the 8 uniformed services of the United States. So this part basically I have taken from some of the website of the US. Right? You can go and check what kind of legislation is prevailing, how the uh, United States is basically getting governed in terms of the various departments and the various what we say in India ministries, right? So you can have a look on that. The origin of USPHS can be tracked to the establishment of a system of marine hospital in 1798. So my focus was basically, or my what I wanted to talk about here is this very thing, that basically if you talk about the USPHS, then you can find its origin linked to the system of marine hospitals in 1798, way back in 1798, and then later on in 1870 these were consolidated into the Marine Hospital Service and the position of Surgeon General was established. That means somehow this process got started with the marine hospitals, and when I'm talking about the marine hospital, then you can understand the context, because the geographical location of the marine is talking about so many things. There were basically concerns of related to the occupational disease, and then there were other issues related to the movement of people, basically the migration of people. So though these two contexts you can think of. Then in 1889 the Public Health Service Commission corp was established. As the system's scope grew, it was renamed the Public Health Service in 1912. So way back in 1912 the Public Health Service basically came into existence. Now much before 1914 also. You understand the impact of 1914. So this Public Health Service Act of 1944 consolidated and revised previous laws, and it is the current legal basis for the public health services. So this is a very brief trajectory of how the public health services in the US came into existence. As of today, public health service in the US is a very important uh, institution. It's taking care of the public health related issues. It became part of the Federal Security Agency and later the Department of Health, Education and Welfare, which became the Department of Health and Human Services on May 4, 1980. So we started this slide while we were talking about the Department of Health and Human Services. So this is a very brief trajectory of growth of the institutions related to public health in the US, because the phenomenon of public health is almost like the UK. And one more thing is important here. Why did we talk about the UK at length? Because the experiences of public health in India were directly related to the experiences of public health in the United Kingdom, because we were part of the imperial government. So we wanted to understand that how public health was developing in the United Kingdom, but simultaneously what was happening in India, that is not known well. And we will see when we will talk about public health in India that the situation was very miserable in India. So I hope that this understanding will help us to figure out several important things like dimensions of public health, and then the significance of those dimensions, and how public health is necessary. One important thing that I would like to talk about, that in many other lectures, basically we will talk about many of those components at length, but primarily in Indian context. So the discussion on public health is not coming to an end, rather it is just starting. So think about this. What is the problem? The problem is emergence of public health related to the consequences of the epidemic and pandemic? Is emergence of public health related to the consequences of the epidemic and pandemic? We discussed this point in this lecture. What do you think? What is your view about that? And then, which public health facilities are available in your locality? Make a list of all facilities. This is an activity question. So think over the problem and this activity question, try to solve it. And we will meet in the next lecture. Till then, take care. Have a great day. Bye.